Okay, Dr. Buford here with one of my favorite patients, and she is in for a 2-month follow-up. I'm going to just describe what she had, and then we'll hear in her own words how she's doing. What she had was a long history of symptoms and pain and dysfunction from a chronic high-grade partial tear in her right rotator cuff. You're right-handed, right?
Correct.
Yeah, and she has a history of being an athlete, played basketball at the University of North Texas, so she's very tuned into her body and how her shoulder works. She did not want to have rotator cuff surgery, so she found us searching for alternatives. And so, what we did for her was an injection in 3 different places into the shoulder joint, the glenohumeral joint, into about a 80% tear in her supraspinatus tendon, which is part of the rotator cuff, and then above the rotator cuff in a part of the shoulder called the subacromial bursa. And so we're 2 months out from that. And so now I'm going to turn it over to you. Tell me how things have been going.
Things have actually been going great. As I explained to Dr. Buford, I had this ongoing pain here for years. Within 2 weeks of the injection, the pain was totally gone. And I have been able to do more, increasing my exercise, my strength training, and now I'm back today for a follow-up.
Great. And let's see your motion today. If you raise straight to the front. So your motion's all the way back.
All the way back.
Show me that little trick you were showing me earlier where you
I
do
can
the
do it.
internal external rotation.
And this is something that was extremely painful for me to do prior. I could barely hold my arm up in this position, not even mentioning trying to,
Yeah.
turn it down and up again. This was non-existent. So now, no problem, nothing.
Great. And this was done with platelet-rich plasma, which was the injection we made from your blood, right? Okay,
Yes.
great. So in terms of percentage improvement, this is one of the numbers we always track in our records. What percentage better would you say you are now compared to before the procedure?
Before the procedure, 17, and that's being modest.
So since the procedure, you're 70% better at this point. And as we discussed, at 2 months, we still expect you to get even better from here, but you're obviously on the right path.
Yes.
Okay,
And
thank you.
I'm very happy.
Thank you for sharing your story.